All right, in this audio lecture, we're going to be talking about disorders of the thyroid gland, this time focusing on hypothyroidism. So I just want to remind you about where the thyroid gland is at. Okay, it is right here. Okay, so this is superficial to the trachea, just inferior to the larynx. Okay, it is a butterfly-shaped organ. Okay, and this organ secretes thyroid hormone. Okay, thyroid hormone's main actions are involved metabolism and thermoregulation. This here is an image of a goiter, right? So a goiter is what happens when you get a buildup of thyroxine, essentially. So before it's ready to be secreted as a thyroid hormone, meaning there's something wrong either in the synthesis or in the signaling. Usually it's not in the synthesis in America because we get plenty of iodine in our diet. It's usually involving some sort of problem residing in the cascade of events, either the pituitary, the hypothalamus, or in the thyroid gland itself. All right, so what is and what causes hypothyroidism? Okay, so this is when thyroid hormone is produced in too little amounts. And like I said on the last slide, this can occur at any point in the hypothalamic pituitary thyroid axis. So remember that the thyroid gland is really controlled by the hypothalamus, which is our central regulator on what is going on. Okay, it releases a releasing hormone that acts on the anterior pituitary. Okay, that releasing hormone is thyrotropin releasing hormone, which causes thyroid stimulating hormone to be released from the anterior pituitary. Thyroid stimulating hormone acts on the thyroid gland to increase production and secretion of T3 and T4. So what causes hypothyroidism? You could get age-related decrease, so above 50, we can see levels of thyroid hormone T3 and T4 decrease. Okay. The most common cause, though, is an autoimmune disease called Hashimoto's disease. And here you have your immune system attacking your thyroid gland, really resulting in damage. So it causes an inflammatory event, and really anytime you have inflammation in excess, it causes tissue damage. And so in this case, we get thyroid tissue damage. And we could also have it be due to drugs, right? So iatrogenic causes. All right. So what are the manifestations of hypothyroidism? Really, these are going to be coupled with a reduction in things that thyroid hormone controls, like metabolism and thermoregulation. So oftentimes, individuals with hypothyroidism are fatigued and sluggishness. They are sensitive to cold, and their body temperatures can run a little bit lower. And ultimately, this leads to an increase in weight gain, right? So, weight gain. Um, and so, since you can't use those resources that you're storing, you end up storing them and storing them and storing them, eventually leading to obesity. Now, some other manifestations can include constipation, right? So, thyroid hormone actually acts as a stimulant on our digestive tract, and it increases gastric motility or intestinal motility, more correctly. So the longer food spends in our digestive tract, the more water is pulled from it. And so this can result in constipation. Okay. Pale, dry skin. This makes sense because individuals are not hot, they are cold. Okay. Hoarseness, hypercholesteremia is a large indicator. So levels of LDLs increase in hypercholesteremia, and HDLs actually decrease. HDLs, if you remember, are the good fat that you want. So when you go to the doctor, you want your HDLs to be high and your LDLs to be low. Because hypercholesteremia can lead to atherosclerosis and vascular disease. Okay. And then we have a couple other direct effects, and myalgia and arthralgia. This would be myalgia is muscle pain, and then arthralgia is joint pain. Okay. All right. So as far as the cardiovascular manifestations, we see hypotension and bradycardia are really key indicators here. Hypotension can be due to a number of factors. And so if we switch on over to this figure over here, okay, we see that thyroid hormone, this is the normal activity. Thyroid hormone has actions on the heart, kidney, and the blood vessels. So on the heart specifically, it It has a positive inotropic and chronotropic effect, meaning it increases contractility and increases rate, both of which increase cardiac output. So cardiac output increases blood pressure. And so if we remove that, we see a reduction in blood pressure given hypotension, and we see a bradycardia develop in the reduction in the heart rate. Okay. It also has effects in that thyroid hormone directly stimulates the angiotensinogen production. Angiotensinogen leads to the formation of angiotensin II. Okay. We also see that thyroid hormone stimulates the sympathetic nervous system. Okay. If you remove the sympathetic nervous system, then we get a dilation of these blood vessels. Okay. For muscle weakness, we see its transition in the muscle fiber type. Okay. For the heavy menstrual cycle, okay, elevated levels of thyrotropin releasing hormone increase the levels of prolactin. Prolactin can increase menstruation. Okay. For infertility, thyroid hormone has a direct impact on gonadotropins. So you're going to see a decrease in fertility there. For hair loss, you see the hair follicles are directly affected by thyroid hormone. And then we have depression, and then a goiter. So a goiter formation is a buildup of thyroxine. Okay, so a buildup of thyroxine because it can't leave the thyroid hormone. So if this is due to Hashimoto's disease, so if that thyroxine can't get out of the thyroid gland, you end up building up a goiter, right, which is swelling of the thyroid gland. So if the damage to the thyroid is preventing the release of thyroid hormone T3 and T4 into circulation, then it begins to build up in the thyroid gland, right? Thyroid stimulating levels increase, which is why it's usually a common indicator that somebody has hypothyroidism, because your body is telling your thyroid gland to produce more thyroid hormone, but it can't, right? So it continues producing, and so levels of thyroid stimulating hormone will be elevated in hypothyroidism. All right. And so we could see hypothyroidism really develop into a pretty severe condition called myxedema. Myxedema is a life-threatening condition where you see the low blood pressure decrease even further, respiratory depression. So not only is your cardiovascular system not working full at speed, but also you're not bringing enough oxygen into your body. Okay, hypothermia gets excessive in this condition. Lethargy can begin to build up. And then if it gets really bad, individuals can slip into coma. So how do you diagnose hypothyroidism? Collect a patient history and physical examination. You're going to be looking for any manifestations like hypotension and bradycardia, weight gain, any unexplained circumstances like that, hypothermia. They are all going to be really good indicators. And then if you have the manifestations, then you might order blood tests. These are going to include thyroid hormone concentration and thyroid stimulating hormone concentration. So if they can key in and where in the axis that you're actually being affected, they can more accurately treat the problem. So if you have low levels of TSH, it indicates a problem with the anterior pituitary. If you have low levels of thyroid hormone and high levels of thyroid stimulating hormone, that indicates a problem with the thyroid gland itself and might actually be indicative of Hashimoto's disease. Okay. To couple this, we're going to run a cholesterol panel looking for those high lipids, so the elevation in LDLs. And a CBC, we're going to be looking for anemia, and then an ECG. That'll be able to support our cardiovascular findings, the heart rate, but also be able to identify any dysrhythmias present. All right, so how do you treat hypothyroidism? You just give more thyroid hormone. So individuals are oftentimes put on medications to replace thyroid hormone. And the other option is to just manage the manifestations. Okay, so manage the blood pressure, manage the cholesterol if you can. And really, stool softeners can reduce the constipation. So really, we probably want to give thyroid hormone replacement therapy, and then while that is working or kicking in, manage the other manifestations accordingly. All right. So that is the end of this audio lecture. We'll see y'all next time.